Good afternoon, everyone. This is Goa Jilani, a disaster governance and risk reduction fellow from Super India. I welcome all of you to this important session. It's a national level panel discussion on CSO programming and national emergency. So, as we all know that managing a pandemic of this COVID-19 pandemic with its nature and scale has been quite an uphill task for governments across the world, including India, where the focus has not only been on mitigating the spread of the virus, but to also mitigate the socio-economic damage caused as an aftermath. With limited health infrastructure and surging cases having a devastating impact on healthcare workers, there is a need to take collaborative approach in COVID-19 management, including greater involvement of the civil society organizations to support the efforts of the government to manage the pandemic. In the past, community mobilization with the support of CSOs have assisted the governments in management and eradication of diseases like polio, measles, rubella, and smallpox, and helped to fill the gaps where the governments were unable to reach. The most recent example we can cite is of the South Asian countries where the civil society organizations are coming up with the innovative solutions to fight COVID-19 and reaching out to the most vulnerable sections. The CSOs in Thailand are debunking fake news and fighting two battles, that is, infodemic, as called by the WHO officials, and the pandemic itself. During this grim time, our country has also seen its civil society organizations rising to the occasion and working relentlessly with the government, especially for relief work during and after the lockdowns to ensure communities are getting access to essential services. However, there is potential for CSOs to assume a much bigger role in COVID-19 management, means of patient care, community sensitization on behavioral change, hygiene promotion, and contact tracing. While the future of our normal life might seem, the one thing that we said with true conviction is that the collective efforts of our society have been a glimmer of hope, and if we are to triumph, we have to continue at it and accelerate our efforts to defeat the virus. This session aims to highlight the role of CSO during a national emergency to assist the authorities in mitigating the catastrophic impacts due to emergencies like COVID-19 pandemic. I want to inform this platform that the session will be moderated by Mr. Vikrant Mahajan, the CEO of Super India. Mr. Vikrant Mahajan has 24 years of professional experience working at interagency policy level and frontline humanitarian action with government, UN, corporations, CSOs, and armed forces in diverse contexts. He represents on governance and policy level committees of several international organizations and currently works as CEO of Sphere India. Today we will be joined by a plethora of esteemed delegations uh, who will enlighten us with their vast knowledge and experience and guide us through regarding the importance of this session and the way forward. We will be having with us Professor Santosh Kumar, uh, who is a professor and IDM. Professor Santosh Kumar is a disaster risk reduction policy, planning and capacity development expert with a long experience of 25 years in different positions in the development, planning and DRF sector. A PhD in economics, he studied gender and development in RDS, Sussex, UK, and received professional training in disaster risk management from Israel, backed with international work exposure at the World Bank and the intergovernmental body of SARC. He has also worked at state levels in different capacities in UP Academy of Administration, Nainital, and RIPA, Raipur. He is an experienced hand in designing, planning, and implementing mitigation and long-term disaster recovery plan and projects. We're also joined by Dr. Ritu Singh Chauhan. Dr. Ritu Singh Chauhan is an international health expert with 15 years of experience in WHO, working in policy, strategy, and planning, program evaluation, capacity building, strategic risk communication for preparedness and response to outbreaks, public health emergencies, in particular to those of high threat pathogens and business continuity planning. Her areas of expertise include pandemic influenza, H1N1 2009, Ebola virus disease, West Africa, UN post-disaster assessment following Kerala floods, and Cyclone Pani. She is presently supporting COVID-19 response in India. We are also joined by Mr. Sarabjit Singh Sahota. Mr. Sarabjit Singh Sahota is an architect and urban planner with over 25 years of professional experience working in frontline humanitarian and development agencies. He currently works with UNICEF as a disaster risk reduction specialist. He is experienced in steering development and humanitarian strategy, leading to organizations, programs, and projects with frontline agencies in the domain of community and social development, humanitarian program management, capacity development, disaster risk reduction planning, urban planning, and design. We're also joined by Mr. Pankaj from from Oxfam India. So, Mr. Pankaj Anand is the Director of Programming and Advocacy at Oxfam India. He is a professional with over 2 decades of experience in program management, advocacy, and resource mobilization in India and South Asia. His areas of expertise are public health, gender, citizen action, governance, sustainable development, and the issues of Dalits, Adivasis, and other marginalized social groups. Mr. Pankaj has led the institutional funding work at Oxfam India and examining the changing institutional donor architecture over the years. We're also joined by Mr. Binoy Acharya ji. Mr. Binoy Acharya ji is the founder, director of Unnati Organization for Development Education. He has been working as a researcher and public educator to promote social inclusion and democratic local governance. Over the last 23 years, he has been associated with networks and government forms related to Dalit rights, gender issues, and decentralized governance. Mr. Acharya ji holds an MPhil degree in social sciences from the Jawaharlal Nehru University. And as I already informed this plate that this session will be moderated by our esteemed CEO of the Spare India, Mr. Vikrat Mahajan. So,
I'm sorry, I believe Gohar had a poor internet connection. I think what Gohar was trying to say is that we hand over to you, Vikrant, and request you to please take over from here. Thanks.
Thank you so much, Valerie, and thank you, Gohar, for this setting the context as well as the introduction of the very eminent panel we have today with us. So today, the theme of the session today is the NGO programming in the national emergency, which we are witnessing. I think is the in the context of a COVID wave two. In this scenario, what kind of programs the NGOs can have? I think precursor to that, I think it's important to bring to the perspective of everybody once that the Prime Minister, Honorable Prime Minister of India, have also given a call out to all the NGOs and the volunteers, to contribute their best efforts in this big crisis which we are facing as a country and help them recover. And adding to that, we also have had a letter which is issued by the CEO of Niti Aayog, a call given to again all CSOs to contribute to through various initiatives and various works with the NGOs more than 1 lakh NGOs which are registered on the Niti Aayog Darpan portal. A call has been given to all of them to contribute their best efforts in the time of this crisis. I think this is the two important announcements at the back of it. But more than that, I think the NGOs and civil society have always been at the front end of action whenever there's a need, whether there's an official call from the government or not. I think we have seen the kind of a work which has been contributed by the civil society very close to the communities at the grassroots levels, and then on the various other levels at a policy and advocacy. So there's a big role to play. Today's discussion, I think, I'll not build on the COVID situation where we are. I think we are all familiar with it, and I'll little bit touch base upon. I think we also had a coordination meeting with the NDMA and the Niti Aayog, where again, some of these aspects, that what is it that NGOs can do in this situation, as well as what are the challenges being faced at the local level, and how the government can facilitate the NGOs work so that we can have a better collective outcomes has been discussed. So some of those things we will put into a discussion today. uh, Straight away going to our speakers to say, but today's discussion we follow a little different format. I think we not just go a regular one-to-one presentation by speakers. I'll encourage all speakers to intervene in between with the questions and their viewpoints on the same presentation, so that we have a more interactive discussion and a more lively discussion, questioning and debating with each other, not just plainly that one speaker makes a presentation and we move to the next speaker like that. So let's do a little bit of reformatting of the way we are having been having these webinars. So to begin with, I think my first questions are definitely, I will start with the Professor Santosh, from the NIDM, who help us understand within the techno-legal framework, and also these two, the appeal made by Honorable Prime Minister as well as from Niti Aayog, including the coordination with the NDMA, what he sees that where is the scope for the NGO programming in this situation, what all things that NGOs can do, and the same is a question to other speakers. I think let's hear Professor Santosh, and we hear different views. See, at this moment, knowing the crisis we have, what kind of a program options we have for the CSOs? Professor Santosh. So you are probably mute.
Thank you very much for organizing this particular event, Vikrant, and all the panelists, Sarabjit, Gohar, and Ritu, Anand, and all the delegates who have joined. Without going into formalities, let us punch on that what has been there in the situation. And Government of India call for this that civil society can help and support. I think first is to that what is the capacity of the civil society at this juncture in terms of helping a very complex situation. And that complex situation comprised of basically a supply chain. And those supply chain, which is all we all already aware in terms of that the task which we have in hand is that testing, then admission, then oxygen, then medicine, and then hospitalization, hospital care, and those who are sick, families also heterogeneously placed. Sometimes only husband wife there in the family. Sometimes husband wife, one kid is there in the family, small kid and all. So mapping of such complexities could be a very challenging, and there we provide whether the food is needed, the medicine is needed. So all we know that what kind of demands have emerged over the years, over the few days, and then we found that yes, to address this complexity, that is one part. And then the call from Niti Aayog and also that previously Honorable Prime Minister's 10-point agenda is also enforcing this, supporting this, reiterating this support. And the third, if you go to the national policy on disaster management, that also provide that support in the preparedness and mitigation and risk reduction for this. And there is a chapter also on the health emergency and mass congregation, this mass casualty management. So here I see that if you can break down different kinds of work that what is the needed, and different civil society group have different capacity to work in different areas. Somebody is good at food, somebody is good at medicine, somebody is good at pooling resources of medicine, and so on and so forth. So that probably is the, I think would be needed. Somebody would be needing childcare, somebody would be needing help in the cremation and other things. So that we need to identify that what kind of NGOs who are helping already, and they are there. Many have emerged out of the situation also. Those one civil society is already in terms of we can say is a very old. They are working in this area and they know. But many of this out of this concern they have come together, and few civil societies from outside the country are also supporting. Second is this budgeting is also required. So many of the funding is also coming from outside. If you are importing something and you require something, that the government of India is also given this leverage and import free up to 30th July or something, that you must be having that paper with you if you wish to import any medical thing or even this equipments to support oxygen supply or some medicine that is there. So what I'm saying is that legal framework and institutional support from the government for inviting the civil society group is on the card. And this is the time where, and I'm not saying this particular COVID-19 only, but it has happened in the past also. Without civil society support, no disaster in the country has been handled. This is also a reality. So this is that a reinforcement that how we are going to handle this situation. And this situation is very complex, where here the civils in many other disasters, you are not likely to get affected, but you are just supporting as a service provider. But here you are also likely to get infected. So what is the chain that our own people get affected as a service provider? Then what is the chain which we can fill in, and then how those who are there already and that can support me. So initial thought is just coming up, and then let me share that. One is the issue of funding would come, and the second is that legal support. The legal support is there, and the third is the areas of expertise where we, in this complex situation, where we wish to pitch in. That has to be identified very carefully, so that we can strengthen the government. And many things which are saying that we are not able to reach to many unreached. Now it has just spread to the villages also. Earlier it was an urban kind of a phenomena. So how we would have the urban and rural linkages, how the rural people who are getting affected, the transport system can they also be brought in here and increase the pressure at the main center, or there we can create new facilities there. So these are the things where the local district administration would be able to support and help. So in this framework, we can think of initial thought, which I thought this is the quick point which I would like to share
Thank
with.
you so much, Professor Santosh. I think you established, I think, help us know the techno-legal framework and the range of services which the NGOs generally provide, in emergencies, to say there is. But this is not a usual time, as you were saying. I think is we NGOs themselves are limited by their capacity. And this is not a very, very unusual time. And we have to look at the priorities also. I think it's the whole nation perhaps has to see the prioritization of services. And same is the prioritization of services need to happen from the NGO side. So I think the top priority is clearly coming out that we need to look at the COVID care, expanding the COVID care. And I think on top of that is coming up the essential supplies, which is becoming the biggest life issue. So Dr. Ritu, I think she comes from an organization, I think W Health Organization, very rightly here. So Dr. Ritu, according to you, how should NGOs' effort be prioritized for immediate, 7 to 10 days? How the NGOs' effort can save lives in next 7 to 10 days, and then of course, short term and mid term. How do we strategize? Where do we put our resources and energy? And knowing the constraint of the system we have. Over to you, Dr. Ritu.
Thank you, Vikrant. And of course, as highlighted, we are staring at a time where there is great uncertainty, widespread social disruption, economic disruption as well. And we know that in a very short time, all our lives have changed. really, like one tends to think that, the pandemic has its effect only on the health of the citizens, but that is not true. The economic repercussions of it are also something that we really need to understand. And the way it has impacted the psychosocial and the mental health of the citizens of this country is also something that we need to take into cognizance. So with all these, we are also staring at, at issues of limited access to healthcare. I think Professor Santosh rightly highlighted that, the right now the clear ask is that of critical supplies, operational support. Many of these things are areas where government is counting on the civil society partners to also come forward and contribute. I think all of us have now at least a family member in our, if not the immediate family, but the extended family or a friend who has been severely impacted by the pandemic here in India. So with the growing connotations of the pandemic, I think it's clear that the government itself, is really overwhelmed right now responding to the pandemic. And therefore, there is need for whole of society response and civil society partners to come forward. I think some of them have already been playing a stellar role. But this is again our time where we sit down and we reflect on what are some of the areas where civil society partners can come forward to contribute and support the Ministry of Health and other line ministries. So as Professor Santosh highlighted that, yes, operational side, the critical supplies, be it availability of beds, oxygen, certain essential medicines, those are of course some of the areas where civil society partners can bring out more verified leads of where these are available, where is it that people can actually, because right now I think all our WhatsApp groups are clogged with people wanting to know where to reach out for healthcare interventions. So that the operational side is of course very, very important. And this is again an area in terms of even highlighting that not everybody needs to rush to a hospital if they come down with COVID symptoms. The ministry has recently updated their home care guideline, the home quarantine guideline, and only those with a saturation level of below 94 would actually need supportive medical intervention in a healthcare setting. Most people will be able to manage themselves at home. So really, we really need to amplify all of these messages. And here again, civil society partners can come forward and contribute. The continuation of COVID appropriate behaviors. I think this is one area where excellent awareness materials have been produced by the Ministry of Health and Ministry of Information and Broadcasting. So again, this is an area which civil society partners can help amplify. The right messages need to the right people. And I think with the expanding drive of the vaccination, I think we need to really work with our communities to overcome the hesitancy that people still have about coming forward and taking up the vaccination. So I think these are very, very important areas where civil society partners can come forward and contribute. As Professor Santosh also highlighted that it's possible that certain communities or households are having deaths at home. So how do we guide them? And many of our people are looking for that kind of information. In fact, WHO has been working very closely with Ministry of Health and other RCCE partners to make sure that all these materials, the right information reaches the audiences. But again, it's a big country, very heterogeneous population, many different languages people are speaking in this country. So within all that scenario, we have to understand that, the most vulnerable, the most in need, especially targeting women, children, families where, the primary healthcare provider is affected, primary caregiver is affected. So those are some of the areas where we need to focus on. I also want to highlight those that are immunocompromised, people living with HIV, those who have underlying chronic ailments. Those are again some of the vulnerable populations that we need to look at, and civil society partners can, with their networks, help the ministry to reach out to all these populations, especially in terms of making them understand that they need to take the vaccination. but also continuing to follow COVID appropriate behaviors and supply of medicines, because let's not forget that COVID is not the only disease that this country is handling. There are so many other diseases and, our biggest, lifestyle ailments, diabetes, hypertension, some of these are also important to take care of. And we know that there are large populations affected by these lifestyle diseases. So civil society partners can also help unclog the medical and facilities at this point by providing some of these, and again, in contact with the local administration, work out what are some of the priorities within that district, because I think different districts are at different trajectories at this point, and the state administration, the local district administration can help advise the civil society partners on what are some of the most essential needs. I think, again, and let's take the examples from the wave that we saw last year. Many of them came forward even in terms of supporting essential interventions for food, supplies, other things as well. And many of our civil society partners are also helping in advocacy, creation of training materials, training those on the front line, making sure that the interventions reach the doorstep. So let us also, acknowledge the contribution of our civil society partners in terms of taking many of these interventions forward. So as Professor Santosh highlighted, in the coming weeks, I think critically it will be the operational side, which will be the more predominant support that ministry is right now banking on from civil society partners. And I think the clear ask and call from the Prime Minister and Niti Aayog is also in the similar direction. But again, some of these, interventions, other interventions also will be critical as we move forward. I want to also highlight the impact the pandemic is having on the mental health, especially of the youth and children. So I think these are, again, areas where civil society partners can contribute through various, youth champions and others who can come forward and offer support to those who are affected with this current pandemic. So I'll stop here and I'll share concrete examples as we move forward.
Sure, sure. Please
Ritu,
feel
just
free to
one
step in, Dr.
point.
Ritu.
Just
Professor Santosh, you want to intervene in?
Yeah. Just I wanted to say what Ritu has said. That in this pandemic, it's not whosoever has got affected. Everybody is affected, directly or indirectly.
Everybody's affected.
Fear is inside in every household.
Yeah.
So that psychosocial you mentioned, so that should be also given focus, Vikrant, in the discussion.
Certainly. I think it's very right. I think front lines is no more, defined by territory. It's everybody's home now. Getting to it is, I think when we see the immediate, 7-10 days, or the immediate to say there is it's the battle for oxygen. I think it's a battle for the beds in the hospitals, and some other essential supplies, essential medicines to say this. Now, I think just to get focused on the immediate needs to say there is, I think in this, again, it's varying from territory to territory. What is it that we can do? There are NGOs already, they're trying to pull up oxygen. They're trying to mobilize concentrators, various kind of interventions already coming up. Latest I saw in Kerala, somebody has set up an oxygen parlor, wherein few concentrators are put up and people are moving in and all those things. So a lot is happening. So I think focusing the discussion on the oxygen, beds, and the essential drugs. My next question is, Sarabjit, I think, please, I think that's a critical for next 10-15 days if we want to save lives. And, how do NGOs get mobilized and see something they can do it in this space, focusing on these top priorities only. Over to you, Sarabjit.
Thank you, Vikrant. Both Ritu and Santosh had to repeatedly use the phrase NGOs can. NGOs can support. NGOs will support. That kind of predictability is still far, far from India. We have never invested in developing a humanitarian architecture where the voluntary sector's role can elevate from a voluntary action to a little more formalized action, where there is an agreement and there is an architecture within which civil society works with government, with UN system, and a range of other stakeholders, including private sector, and so on and so forth. So I think within this current situation, we are all forced to say that NGOs can. And I think Ritu mentioned very apt, I think I fully agree with her, that going local is the way. Because locally, the things are very different. I can tell you that my hometown is one of the major suppliers of oxygen to India. I come from a steel city, and there's a huge amount of oxygen being on a daily basis being shipped from there. But the mortality rate in my hometown is very high. Why? So it's not only about oxygen. There are many other things, and I think that's this is a complex pandemic, and this disease is fairly complex. Ritu would agree with me, I think, that there are many other dimensions to it. Unfortunately, we only focus on one or two, whatever media tells us. It's fairly complex. Now, within this complex situation, I think, as Ritu has suggested, going local is the way. UNICEF currently is experimenting, I would say, or piloting in the state of Maharashtra, which has remained the hotspot ever since. At least in the 4 hotspot urban centers in Maharashtra, to support the local administration, develop short-term plans. Short-term means almost on a daily basis, or a plan which is on a weekly basis, which has daily elements, which is jointly developed with multiple stakeholders, so that they have little more formalized role in addressing specifics of the response. So in Nagpur, in Nasik, in certain parts of Mumbai, Pune, we currently sort of engaged. And then there are other dimensions of response, which is the urban versus the rural part of the district. I think that's where NGOs have a significant role, because they have a lot of reach. The outreach services, which can come from NGOs for establishing any kind of social protection services, and transitional services of any kind. Ritu mentioned about some of these non-communicable diseases which people live with. So they need continuity of services of various kinds, and so on and so forth. So I think NGOs certainly are a significant role player in any emergency. But in this emergency, which is a pandemic, we could be a little more organized, because handling any epidemic requires an organized and planned way, including surveillance and data-driven approach to not only from the national level. National level approach is national level, but you require the very tightly planned response at the local level. So leadership is the critical success factor. When you talk about local, I think who's leading the response, and I think again there are Disaster Management Act certainly empowers the district magistrates. So in Maharashtra, we are certainly again going back to the system that we work with the district magistrate, and the urban local body, and the little divisional commissioner's office. So between these three actors, trying to address a large geography, as well as including lots of civil society actors to go a little intensive into various aspects. So I'll stop here, and maybe later on, I'll come back.
Yeah.
Vikrant, can I just suggest what sort of
Yeah, please, Santosh.
point just quickly? That in the Disaster Management Act, we are working accordingly. That act has been implemented, but largely at the local level, it's not only the DM and others, but the other health sector, like the CMOs. They are the actual executor at the, because this is pandemic. And district administration is supporting the health bodies. So state level also, Principal Secretary Health is responsible for this. So accordingly, we can think of. So both the disaster management divisions and also that health sector.
But I agree with you, Professor Santosh. But I think what Sarabjit is saying about the leadership part of it, uh, I see again, over the years, the way the system have been, maybe the capacity to lead have also been left with more with journalists than the specialist, sectors, like a health specialist coming and taking an overall leadership, or any other sector otherwise taking a leadership. I think we have seen it's mostly the journalists, the administrative services which overrides the leadership here. Perhaps we need to see the technical leadership also coming up. But I think I'll still want to have the focus of the on discussion on the. I'll
Actually,
come back to you, Professor Santosh, but I think going to move to the next speaker with Pankaj also. I still want to have a focus of a discussion on the oxygen and critical supplies of the beds and other life essentials. The Sarabjit and has rightly said, probably there may be other factors to the both mortality and morbidity, but and media is painting up a picture. But what we are seeing is not the media. We are seeing social media. People are we are seeing the visuals. We are seeing people are crying that they in the need of oxygen, in the need of this, that we ourselves are trying days and nights to get arrange a bed for somebody and all, and we in the end of after spending a whole day feel so distressed that we have not been able to do anything about it, to say this. So focusing on where the problem is, maybe Pankaj, if I will request you, I know from the efforts of the many of the organizations. So you tell us, like, what is it the NGOs can do? What are the challenges, um, which is coming up in between, and how that can be facilitated so that these some of the immediate critical needs can be addressed. Over to you, Pankaj.
Thank you, Vikrant. And I was hearing with rapt attention all my previous speakers. All points very, very well taken. I am only going to share some of my practical experience of having seen it in the last 21 days. Um, and I will also do a little bit of personal thing. Just like all of you who are here on the panel and all the participants, that on a daily basis I do 2 or 3 things. One is my professional role as a humanitarian person, of seeing how the procurement is happening, how the program people are being deployed, how people are being taken on the roster or taken from the roster, and how is the money coming in, the fund situation, the grant agreements, etc. This is my professional work. In addition to that, on a daily basis, as a private humanitarian, which all of us are, to see that somebody is asking for plasma, somebody is asking, because you are a humanitarian person, you would have access to remdesivir, you will have access to oxygen. At the end of the day, I sleep with a very heavy heart that all day I tried and I could help only just one person with something very small, just 17 tablets of Fabiflu. That's all that I could manage during the day. Uh, that's one. And the last thing that I do is also mourning of having lost a friend, a family member, an acquaintance, a neighbor, or someone. It's happening all around me. And then also asking my sister, how are things there, etc. But I think that in all this, this is a great time for compassion and solidarity. Solidarity between all of us, all institutions, government, civil society, no matter where we are, UN, all of that. The whole country is now gasping for breath. It's a very, very dreadful sight. Very, very dreadful. Uh, Now, I just want to come to, because I completely buy into the the things that have been discussed about the urgency of medical supplies. Absolutely well taken. Right from the day one, we have been saying that we are a WASH organization. We are a food security and livelihood organization. Changing ourselves into becoming, you know, we, something to do with medical supplies and equipment was not easy. We are also trying to understand, which actually meant getting in touch with and remaining in touch with doctors, nurses, paramedics to understand their perspective and their ideas. And overnight changing yourself is not very easy. But we tried, and we are still trying. Every day when I ask for a JD to be written for staff nurses or paramedics, I myself don't know what I'm asking somebody to do. I have no idea of what should go in that JD. It's a struggle. We are struggling, but we are trying. And that is why I say that solidarity and compassion at the human level, but also at the professional level is needed. I just want to say that all of us are facing, those who are trying to procure medical supplies, equipment, and consumables, big problem of three things: price, availability, and shipment. The entire supply chain is a huge issue that we are facing, and we know we are being fleeced. We know हमारी चमड़ी उतारी जा रही है. वो उनको पता है, जिसको भी पता है कि हम क्यों इतनी जल्दी में हैं. And yet we are letting it happen. In normal circumstances, we have a very robust framework of how we purchase and how we run our logistics and supply chain. In this case, we are having to put all our internal rules on the back burner. But that's the beauty of being a humanitarian, that you need to adapt. Adaptation is a human quality, but we have to do it now. I just want to also highlight one thing, that while everybody will recognize and everybody should recognize the need for medical equipment and supplies, but I'm just making an appeal that please do not let the food security situation off your side, because because of the last year's economic downturn, losses, the job losses, loss of livelihood. We have seen the visuals of thousands of kilometers of travel made by migrant workers going back to their villages to find nothing. There was no NREGA, etc., etc. That story we all know. But a very important thing not to lose sight of. Therefore, if we can do a bit of balance between the two, the irony of ironies is that we are a food surplus country, and yet I am talking about food security. And I understand that at least some of you will agree with what I am saying, that food security situation is a building up situation. Over the next 6 months, 1 year, things might become even more difficult because of continued lockdown, extended lockdown, weekly lockdowns, curfews, etc. And people will continue to lose their jobs. So this is not going to ease anytime soon. It is going to become even more difficult. And so this is an important thing to keep in mind. The most important other thing that I think I should raise is about which is basically, I'm reiterating Ritu's point about psychosocial support and counseling. I have never seen so many people living in so much of anxiety and fear, and sometimes fueled by misinformation, disinformation, sometimes God knows how many things are playing on a person's mind at any given point in time. So this is not something that we should lose sight of. And the last thing that I also want to say is about discrimination. Vikrant, if you allow me another half a minute or so.
Please, please,
Uh,
please. Yes.
and this is just a discussion. I just also want other people to comment on what I have said. That we know that discrimination is not just uh, you know is is in India. It is everywhere, globally. Different kinds of discrimination is there. But one specific discrimination as a result of COVID-19 that we have all seen uh, is the resultant of discrimination is the stigma. And I just want to say that the stigma against religion, we know about the Marcus case. I don't want to go into the detail of that. Stigma based on professional, we know that the against the health professionals, there were widespread reports of discrimination, all because of maybe disinformation or misinformation, but it was there. Stigma even over a death, that we have several documented cases of disruption of burials and cremations. We also know discrimination based on race. There were several reports last year during COVID first wave, the discrimination faced by people in Northeast, Meghalaya, Tripura, Nagaland, Assam, and all these places. There were several stories. And these are some of the stories that I have not only read in the newspaper, but some I have seen people narrating to me, which was their own story. So I still have images of what was told to me, and the body language while the story was narrated to me. And we have also seen the stigma against migrant workers when they went back to their villages. They were very badly mistreated, etc. So I think this is also something to be kept in mind, that stigma arising out of discrimination should be kept in mind. We as program people, when we are designing, if we can do something about it, should be done. I'll stop here.
Thanks, Pankaj. Thanks. Sarabjit, I see you quickly want to respond to something. Maybe just quick one.
Yeah.
And then after Sarabjit, maybe I will also add
Yeah.
2
So,
cents.
yeah, thank you. Pankaj, you mentioned about Oxfam graduating from environmental health, food security organization into a little bit of medical side. Now, I think same would be true about us as well. But we had our systems in place. And I've just put the kind of supplies which we have provided to Government of India in last so many months in the chat. Now, that was, we procured everything from abroad, majority. Now, Vikrant and probably Professor Santosh, and I'm also asking question to myself and Ritu, where is the coordination? Why Oxfam has not reached, Oxfam and UNICEF haven't spoken about how can we help them in procurement? So there are opportunities to work together, collaborate, coordinate, and do a coordinated action. But I think I have never seen such a need. I've seen emergencies right from Gujarat earthquake to every international ones, national ones. But I think we are not at our best.
Yeah,
we're not at our best.
Certainly, Sarabjit, and while me and Pankaj had a quick discussion before this meeting, to look up some kind of an intelligence procurement mechanism, to look at some logistics coordination to come into place. But I think I'll get back to that later on. And before having an intervention from Professor Santosh and Ritu, maybe we just listen to Dr. Binoy Acharya. And then I come back to Professor Santosh and Ritu for your quick interventions in between. Binoyda, how you see maybe at a local level? I think Pankaj has rightly put this thing, the challenges with the current critical procurements, but then the food security and other important issues where we need to focus on in the maybe immediate and the short term. So what do you have to guide us over that, Binoyda?
Thank you, Vikrant bhai. What you rightly said at the beginning, what should we be doing next 7 days? If I will say that what we do next minute. The situation is so urgent and so desperate, we cannot lose even 1 minute. What Pankaj bhai is saying, I'll come back to that afterwards. But you must have seen the newspaper today, Indian Express, where Dr. Anthony Fauci, he has served 7 American administration. He said that India, the situation is so desperate and we cannot think about analyzing anything. We cannot think about making anybody responsible. We need to only respond. And I will say, particularly with my CSO brethren, that our aim should be to prevent one person getting infected. Our aim should be to prevent one person going to the hospital. We must prevent one person going for oxygen. If these 3 are our objective, then in next 7 days, next 15 days, we'll achieve a major kind of ground. I'll tell you, I have been in, you know it, I'm in many of these meetings. Last May, Dr. David Nabarro, who was WHO kind of a point person, he said that last May, today we're in the 1st May, about a year back, exact date I forget, is 16th or 14th May. He said that time India has done very good so far because we produced many things, we ramped up our systems. He said that now the time has come to develop a decentralized mechanism because now the virus is entering villages. So only a decentralized mechanism can stop it. You know, I was hearing to Chehal Sahib, who is the municipal commissioner of Bombay Municipal Commissioner. They have set up a jumbo setup in which in one centers, 2,000, 3,000 people are getting bed, and out of that 200 people are in ventilators. So that is one system. But as NGOs, what we can do, I'll tell you a couple of points. I think first one is, even if our ministries, our different departments, they have been working on IEC material, those materials are not very relevant at the ground level. Because what Rituji was mentioning, we speak different languages, there are local cultures, our message has to be locally relevant. And today that messaging is wrong. And if you see our whole protocol about home care, it is gone to 5 pages. Who the hell is going to read about it? Make it simple. I'll tell you, the new research is happening every day. But is our messaging changing? No. What we need to tell right now, in fact, we are doing it through voice SMS in Marwadi language. So that reaches Badmer, Jaisalmer, Bikaner, because they speak Marwadi language. So depending on local language, we need to tune accordingly, make local mechanisms relevant. So take for example, right now, we need to say that this is created by droplets, by aerosol, and we need to stop it. So when you talk, don't remove your mask. Simple. And Dr. Paul has already mentioned, even in home, we need to have a mask. Because who is symptomatic, who is asymptomatic, we don't know. Simple, this message will prevent us from one person contacting virus. Very simple. Don't make it complicated. Number 2, as soon as our system has collapsed now, let's accept it. Anybody who is having even a little bit of some symptom, even 99 fever, right now, even if you test, by the time you get results, it will take 72 hours. That is my personal experience also. In Ahmedabad, sitting in Ahmedabad. What about remote areas? You can imagine. So whether testing or no testing, in fact, district medical officers, even below that, CHC and PHC, now they know that what kind of medicine need to provide. But what is happening is, there is a huge pressure to over medicate. That need to be stopped. No one is talking about it, over medication. Everybody is providing what is called remdesivir, Fabiflu. You don't require. In fact, I will tell you, yesterday, one of my drivers whose oxygen level has come down to 94. And they were about to take him to the hospital. I said, stop. And I did that, what do you call, slipping on the stomach.
Proning. It's called proning.
They didn't know how the proning has to be done. So I demonstrated in the veranda. Then they did it inside. And his oxygen level came to 98. So one person is stopped from going to the hospital and taking oxygen bed. So many things can be done. In fact, my wife right now, she's having COVID. She's not taking any medicine. And last 4 days, she doesn't have any fever. She only took vitamin C and paracetamol, not even Dolo. But now everybody is fancy about Dolo. I don't know what that company is doing. Paracetamol is good enough. And you continue to monitor your temperature. In fact, I'll tell you, even many of our Anganwadi workers, even what do you call, ASA workers, they don't know how to read a thermometer properly. And we don't have electronic thermometer, which will be provided. They don't know how to do it. So what NGOs can do is build the capacity, build the messaging very clearly at the frontline level, reaching to the village level. In fact, I'll tell you, one of my colleagues was telling me from Kutch. She said that every second household has one person who's having fever. Fever means it's a COVID positive person. Now you need to isolate that person. And I was telling our government, Gujarat government, I was saying that I've been telling that for 1 year. Now they're doing it. Now they've accepted. Every village has 3-4 Anganwadis, every village. So make 2 Anganwadi, which has a fairly good toilet and water facility, bathroom facility, and make 1 for men, 1 for women, isolate them. Because take, for example, in rural India, there are 4 generations living in under one roof. It's grandparents, it's parents, it's self, and the children. The 4 generations is living in one. If one person is contacting virus, it can infect the elderly people, it can affect the children, then it's very complicated. So immediate isolation, and that can be done by NGOs. You don't require a circular for that. Every village level it can be done. And the same household people, they come and feed them. And bed can be taken from the house. So you don't require any other service. So NGOs can provide that. It is possible to do it. So my simple thing is, I don't want to take any time because just we prevent people from contracting the disease, stop going to the hospital, and stop from getting oxygen. Because we as NGOs, because why you might be knowing anything, we cannot procure and oxygen. This can be very well done by industries. They produce good amount of oxygen. Let the Piyush Goyal bring the oxygen by train. Let the railway ministry do this. Let the transport department do it. Let the local administration do it. That is not our forte. We cannot do that. Coming back to Pankaj Bhai's question, that is very relevant. As a local level, we need to do oversight so that no one is left out. No one is remain hungry. No child should be left out from the take-home ration. The midday meal must be provided to everybody. The PDS subs must be provided. Prime Minister Garib Kalyan Yojana free ration must be provided. So an oversight need to be done. And oversight doesn't mean that you are going and doing Jindabad Murdabad, basically ensuring that everybody is provided facility. At this time, we cannot pick up a fight. We need to be united and work on these issues. So this is super emergency. In fact, in my, you can see what is my age, I've never seen this kind of a situation. So we need to have patience. We need to put our act together, whatever our capacity. Even if we reach to 10 people, that's good enough. Don't have to reach to thousands of people. So that is my call. Thank you, Vikram.
Thank you so much, Binoy. I think your message is always on the point, and whomsoever we can help, and prevent from going to hospital. I think it's that's effort saves a life. Dr. Ritu, you wanted to make a quick intervention that time. Over to you.
Yeah, thank you, Vikrant. I think it's very inspiring to hear some local solutions from our great stalwarts who are, sharing with us their perspectives. So I wanted to come on the point that was made by Pankaj on stigma. I think, especially in the beginning part of the pandemic, when this was a new disease and people did not quite understand the implications of what it meant, we saw the stigma pan out in a much bigger manner, affecting not only COVID affected families, but also their friends, healthcare providers, various other personnel, police personnel, many other stakeholders were also being stigmatized. Um, and I think this is a one area where really civil society had also come forward and contributed, and we need to acknowledge the efforts. Of course, a lot of work was done by the government, and we as WHO, UN agencies had also contributed. A lot of trainings were undertaken, including those of the frontline workers, those who were handling the, toll-free number, the 1075, 104 helplines. Again, we are now rediscussing what kind of trainings we need to provide to our reorient the frontline providers. I think some of the points that Benoyji has made on proning and, making sure that most people can be managed at home. I think these are again some of the issues that we need to reorient our frontline functionaries towards, because we know and understand that most people will have a mild disease or will be asymptomatic and can be well managed at home. And this is the guideline also from WHO. So having said that, I think there are experiences that we have learned within our own country handling stigma. And I think in that particular area, the NYK, the NSS, Red Cross, Sphere, many other agencies came forward and contributed to ensure that the stigma could be averted and stymied. And again, this is one of the experiences from we learned that whole of society engagement sometimes is needed. I remember the first meeting where secretary had brought together all the partners and said, look, this is what is happening in the country and I'm counting on your support. So we know that the government will be banking on the support of civil society and NGO partners. And to the point made by Sarabjit on the need for a more formalized architecture, I think those things we can discuss, when we are over with the crisis of what went well, what did not go well, what more needs to be done. And there are frameworks available from WHO to even do that, the after action review and even intra-action review. We have just completed intra-action review in the state of Gujarat, where we have looked at the entire 10 pillars, starting from governance, leadership, stewardship, up until looking at the entire pillars of surveillance, laboratories, points of entry, infection control. Various elements were thrashed out. We looked at what worked well within the state and what did not work well. But I think clearly this is the time when we have to support the government in terms of operationalizing what the guidelines are. And I'm, of the opinion that right now all our energies should be focused on how do we do that. We are also talking about, if mobile hospitals or field hospitals, etc., could support some of the essential healthcare services at this point to declog some of the facilities that, to make sure that COVID patients do get the sort of care and the beds are reserved for the people most in need. So these are again some of the initiatives in which civil society partners can come forward. I think by and large, it will still hinge upon people adopting COVID appropriate behaviors. The 3 W's, wear your mask, hand washing, and keep your distance. I think those things are something we really have to, and we know that, mass congregations have been taking place, festivals and, places where people are getting together. So within those scenarios, when people do not wear masks and all, then we know that things can flare up. So again, these are some situations that we need to particularly look at to avoid. So within that milieu, I think it's important to also understand what are some of the concrete examples where engagement with civil society is working or will work. So WHO has also been partnering with some of the agencies, and we are working with Disha Foundation on migrant populations, and somebody was highlighting the very important issues of the returning migrants. And, the whole issue of livelihoods of migrants is a separate issue, but I think the health of the migrants in particular, because we being a health agency, we will prioritize the health of the migrants as well. So linking them up with health and wellness centers, places where they can get themselves tested if they have symptoms, because a lot of people who may not have Aadhaar cards or national IDs are likely to fall through the cracks. And then how do we provide that kind of access, healthcare access to those populations is also something that we really need to take stock of, so that nobody, gets missed out. Again, we are working with Engender Health on pushing some of the messages on COVID appropriate behaviors to the youth. And we know that it is going to be the youth behavior, which drives many of the surges in different areas. So because we know that this lot has, is being down on priority in terms of even vaccination. And now, of course, with 18 plus also, being encouraged to go for vaccination, things will change as vaccination programs pick up. But definitely we need to talk about youth empowerment at this point, and how do we engage our youth in supporting some of these services that the country immediately needs. We are also working in some of the tribal areas, as the organization, with a rights-based perspective, we also want to look at areas which have more tribal populations and where we know that the literacy level is low, and how do we then reach those kind of populations with the right messages, and what approaches can work, especially during lockdown scenarios. I think these are again some of the issues we need to be discussing more. I think somebody also mentioned that there are so many materials which are being produced, but we need more simple materials. I think Binoida mentioned that we need simplicity of materials. So this is again, we are working on FAQs, something which can be translated into multiple languages across the country, to make sure that very simple message reaches, our last mile. And of course, we are also working closely with many of the other RCCE partners in terms of trying to understand what the population feels at this point, trying to track the perceptions. So we are working with IDEA to look at, we have just launched in the last 2 weeks, we have launched a nationwide survey, and we are looking at trying to understand what is the eagerness of the population to take the vaccination, what are some of the hesitancy related issues. I think listening from the affected populations is also very important, and this feeds back into what kind of interventions needs to be done immediately at this point. So we are working with different agencies, and we will continue to engage moving forward, to hear from others on how best we can strategize, even in terms of engaging with civil society. Over.
Thank you so much, Dr. Ritu. And Professor Santosh, you also wanted to make an intervention that time, maybe a quick one. We still have...
I really appreciate what Vinay has mentioned. Vinayji, you have mentioned very, very pertinent points for that the local level. Even preventing one person probably would help in reducing the kind of a pressure on the system. Civil society, I think I can tell you 2-3 examples quickly, which can help. Like RWA is a one where we can talk about, like in our society and other neighboring society, we said that if you have a kind of a people are running around with the oxygen cylinder and all, the need was just to have an oxygen, and that is taken care of. So what Vinay is saying, the similar kind of a model, which we say that yes, you have a 2-3 kind of a this concentrator, and 4 or 5, every society has a kind of a community hall. So 5-6 beds you can put that, and they can be isolated also, and they can be given treatment also. So this kind of a model for RWA civil society can talk in the urban area where this kind of a problem is there, and the rural area, of course, that Anganwadi or Panchayat Bhavan, that can be taken up as a kind of in the quick with the Panchayat, and also talking to the local bodies at the local level. So this is one where quickly we can swing into action for democracy. Second point is coming up that everybody is thinking, like even my family, my daughter is pressing on me that why don't you have a concentrator for the, then I spoke to US, and then I wanted to find out from my relative, can you export that, and so that I can have my daughter is after my life. So what is happening, this kind of a panic is all around. It's not my house. So when I spoke to other relatives, they also asked me, why, if you are asking and get 5, 6 concentrators. Then I found that 6 concentrator could not be possible by taking one individual. So then you have to have a civil society. They can import for you and then they can distribute it. So this model was adopted in Jharkhand and Bihar. So the group was formed and they are importing such kind of a concentrator and all. I spoke to Dubai and there is also the government is asking. Also, Dubai is also falling short of this kind of a concentrator because they have to supply to India. So what I'm saying is this firefighting operations is still required. Preventive one thing which is very, very important. So reducing the pressure. One job is this, explore possibilities of loading by different methods, offloading the pressure on the system by RWA or other mechanism, or if 5, 6, 10 people are thinking of having a concentrator in one family, they can maneuver. The third thing which the disinformation and misinformation which is coming up, like I said, Dinesh said, Pankaj said, that everybody is after, I am getting more than in 2 days, 100 calls for remedies. If that no agency is saying that I myself, in my brother's case, I used it, I failed it, I plasma, I used it and failed it, and he succumbed to COVID-19. So what I'm saying is that we are actually not knowing that how disease will play, and maybe somebody is getting saved by this remdesivir, but WHO can play a very critical role in this, talking to the Indian Medical Association or State Medical Association, that what doctors should prescribe. That is very, very important. And many of the tension would averted when WHO can take this lead with the two civil society. That these are the protocol as like All India Institute of Medical Science is bringing. So the same kind of a WHO can give to the civil society, and civil society can disseminate this information. And last but not the least, what Pankaj was saying, that stigma, yes, that this year stigma was much more than this year, because this year every family is getting affected. Everybody has every family almost has lost one dear ones or known in the family. So what I'm saying is that this time, the first lockdown, people enjoyed being at the home, and they were having different recipe and they were managing their stress differently. This time, people are into fear. People do not know that who is the next in the queue. And if that is in the situation, we will not be able to get any bed or any support or any oxygen, and we are going to die. So that fear has gone into every house. So how to actually de-stabilize this fear? How to work on the civil society can be very, very engaging on this, because their reach is very strong. And people, those who work in the civil society, they don't, forgive me, all I'm also from the government, but government approach is different. Only civil society can have a better communication with that. So these are the things which I wanted to flag when we are talking about. And of course, that feeding is important. Many students are living in the hostel still, and they are living at a kind of a paying as kind of a scenario where they are affected, one family get affected. So what I'm saying again, complexities have to be recognized and seen, that differential need have emerged for not no school is there. So the idea is to look at the children and the women issues and other also in this. Thank you.
Sure. Thank you so much, Professor Santosh. And we still have another 10, 15 minutes with us. And I see Sarabjit want to say something, but before that,
One point. Can we, civil society can effectively engage civil defense into immediately, because they are the biggest thing in most of the states, they are there. So capitalize on that also, youth forum and also civil defense.
yeah, that's there. I've had a challenge, Professor Santosh. Maybe, not many of them, like digitally connected, are able to connect digitally. Civil defense, we couldn't get a database or the people, in terms of their mobile numbers or email IDs to whom we can digitally connect with.
Let me
Uh,
help you in that. Let me ask my office also to get this connects from the civil defense from different states.
sure,
Whatever we get, we will start working on that. Even if we get 1, 2, 3, 10, we can do that.
definitely. I just was
I
saying,
just want to come in, Vikrant.
yeah, Dr. Ritu.
Just one point. It's very relevant to mention that we are talking about, many of the people either self-medicating or taking overdosing, not taking the right treatment. I think these are very important concerns. There is over consumption even of antimicrobials, and which also has implications on emerging antimicrobial drug resistance. So I think this is really the time we should expand the teleconsulting services across the country. And this is a good time to look at what kind of investments are needed, because since there are lockdowns in many areas, people will not be able to access healthcare. And because the health systems are stretched at this point, people who actually need treatment can be advised over phone, because we know the mobile phone penetration of this country is huge. I think this is one area where civil society partners can also contribute. As Binoyji mentioned, that most people do not need excessive support, excessive treatment. No, everyone does not need remdesivir. This only has to be advised by a medical practitioner. So I think I just wanted to flag this point, for our discussion forward. Over.
Thank you so much, Dr. Ritu, for bringing an important point. Yes, as sphere level, we are trying to work out a mechanism for the teleconsultations, and also I take Sarabjit's point, but we discuss about the NGOs capacities are varied. I think we have in the country a lot of organizations, who have a capacity and are having counterparts across the world who are looking at various procurement actions, of the essential equipments and this critical needs strengthening the government system. So some level of coordination needed to be established between these agencies. I think we'll get on those actions, and then there are very very local level NGOs who needed to be supported and facilitated again from the civil, the administration side. I think we have already raised the issues of the sub granting within allowing sub granting within the FCRA, and some of the critical the amendments which have been come up, how that can be relaxed so that the local grassroots machinery can also be more enabled and more mobilized to looking at in this crisis. So there's an all-round effort being put on, and a very good and many NGOs are playing roles at a multiple level. I take up one or two questions from the participants, and though I see a hand raised by Hina, there was a question in the chat.
Can I make one point before we take points from participants? So one is that Binoyji has given you a fairly good framework of 3 ones. Go with a program approach. Provide leadership to the civil society to take go on these 3 ones, plus 1 point from Ritu on youth behavior. So 3 ones plus CAB focused on youth could be a good program. I think go with a programmatic approach, and that's my suggestion. Number 2, a message to government. So I see Professor Santosh as a representative here. As we address the short-term needs, address oxygen, address this, address that, there is also the learning from 2021 is that we should fix the systems, the systemic deficits. The pandemic is not going away. We need to fix the systems on the go while we are addressing the short-term needs and the medium-term needs, which are emerging on a day-to-day basis. I think those are important lessons from 2021.
And Sarah also recognized the innovations like the Langar oxygen was a very good concept which has come up. So many faith-based
Yes.
can bring that. It's a very wonderful example. So let this kind of example be extended to many of the places.
The langar, oxygen langar, or maybe the oxygen parlors, which we've seen also in Kerala. So we have a question was I seen in the chat, and I see the Kanal Srivastav is there in the participants raised his hand also. So the question which I pick up from the chat is that somebody is saying, is it not a time for a national lockdown? I see a report from also Dr. Fauci from the US. He's saying the critical situation in India, it's a best advice thing is to go for a national lockdown for a couple of weeks. So maybe any quick comments onto that. Kanal Srivastav, you please be ready. I'm giving you right to unmute and ask your next question. Any comments on the lockdown part? Any speakers? Maybe Professor Santosh?
I think lockdown already government has taken decision and saying that go by the controlled kind of zoning where you find that and the directions also given as a kind of a guidelines. You can say the parametric if these parameters are there and you can go for the lockdown. So that has already been explained by and government has taken decision. And because it's a larger issue for the national lockdown, maybe our comment would not be very relevant at this stage here.
Sure. Yeah, as the Prime Minister has said, talking about the micro, lockdowns in a micro zones, basically. So, Colonel Srivastav, do you want to say something?
No, I want to say very clearly, Vikramji, lockdown is not a solution.
Yeah.
And stringent lockdowns are come in the way of the livelihood. And I think as CSOs, we should not make any comment about lockdown. Rather, we should oppose lockdown. We're saying that let the life continue. But life continue so that we don't infect more people. So a lot of mistakes have happened in the past. This is not a time to even discuss about those mistakes, but at least let's not make new mistakes. Locking down, as Rituji was also mentioning, so many migrant workers will suffer more. In fact, Gujarat government has decided that it will make micro containment, and many of the malls, eateries, those have to be stopped. So as a consequence, you see on the road there is less traffic now.
Definitely.
But offices are running, medical system is running, industries are running. So life is fairly normal, but with some degree of constraint.
I agree with you, Binoida, and it is more maybe lockdown in a micro zone or the self-imposed lockdown by communities. We saw Trader Association in Chandni Chowk and in Delhi have imposed a self-imposed lockdown. So these kind of community interventions can also be helpful. Over to you, Sanjay Srivastav. You please ask your question.
Good evening. Thank you, Vikrant, for giving this opportunity. One of the problems which we are facing is at the local level, especially at the rural areas, for coordination. And we are getting calls like people are sick and there is lack of medical care and the advices to them. So if at local level we can go and advise them something, government machineries are overloaded and mostly concentrated in the urban areas. But rural areas, especially in tribal, economically weaker section, this coordination aspect among civil society organization, that if we can do, we'll be making a big difference. So that is my question as well as a suggestion. How can we go for a better coordination at local grassroots level?
Thank you so much for your suggestion, sir. Any comments on the question part of it? Maybe Sarabjit?
I mean, we have significant experience of working on local level coordination, particularly district and sub-district level. And one of the critical success factors in local level coordination is that it should be led by government, but technically supported by the real technical people. So there should be a plan behind coordination, not coordination meetings. There should be a plan. So a local area plan or a district level plan or a sector plan, which helps agencies, different agencies, to bring in their respective resources to implement one plan. So I think that if that model is adapted, we have enough resources around the country to advise government technically. I think our civil society partners, our others, private sector, etc. A lot of them are there. The only thing is that enabling environment is required where we can interface. And I forgot to use this term earlier, but interface is the key thing. Interface between civil society and government doesn't happen automatically. They are not the natural partners. You need an intermediary to facilitate that. And I think that role UN need to play a little better. And I think whenever we have played it, we've succeeded quite well.
Thank you so much.
Maybe I'll add a few points here. I think it's a very relevant question. Our 2,600 workforce working, ordinarily in the areas of polio, hypertension, neglected tropical diseases is now entirely repurposed and supporting COVID-19 interventions in the field very closely with the district health administration, state health administrations. So that said, the steering of the response has to be government driven. Partners have to come forward and suggest the various areas where they can support. The government can list out areas of need, as we discussed in the beginning, district wise, even block wise. We really have to look at, really going down block level for our planning and look at what are some of the local solutions which are available. There could be solutions that could be interstate. 2-3 different states can come out and work out a solution if need be. Center is also providing technical oversight. In fact, a lot of international donor assistance itself will also be kicking in the coming months, already starting on with many of the donors pledging. So I think this is really a time where India will be looking at all hands on deck, and we as partner agencies really have to make sure that we sustain the momentum of the work which is needed. It's going to be a difficult, arduous time, but this is where the government is counting on our support. And I think it is incumbent upon us as partners to make sure that we are there for them, supporting them in every way possible that is needed to make sure that lives can be saved at this very important juncture. But that said, local level planning is what is most critical and most needed. I think government is already working on this, but as weeks and months, we will see that even in terms of not just emergency response, but also building that resilience for further waves, because we know this is a marathon. The pandemic is not yet over. What lessons we can learn from some of the experiences now will have to get integrated into planning for the immediate months to come. So interaction reviews, looking at what are some of the learnings, distilling what is working well, scaling that up. I think all these interventions is going to be very critical in the coming weeks and months overall.
Vikrant, one urgent question.
Sir.
In fact, this morning somebody called from US, I know. They are a group of friends who want to support one oxygen plant for a district hospital. And they want to give it to us. I said, boss, wait for a minute. In fact, I have already communicated to Vani saying that please find out if I transfer that money to set up an oxygen plant, will it be called soft granting or not? Because it's finally giving the entire property to another government institution. So will it be called soft granting? Because there's no clarity about it. So
I understand.
This clarity must come immediately. People want overseas support, but I didn't mention it in my first presentation because I don't want to get into this murky business right now. Right now, my point is to save life.
Sure. Pankaj, you want to comment on this one?
So this is precisely the point that I made. पर मैंने छायावाद में बोला था कि the tools and facilitations required by NGOs. Who will provide the tools and facilitation? The government has to clear some roadblocks and barriers. We will run. मैं आपको पहली बात ये बताता हूँ, हिंदुस्तान में 2004 के बाद से कभी भी या उसके पहले पूरा इतिहास, ऑक्सन तो 1952 से हिंदुस्तान में ह्यूमैनिटेरियन का काम करता है, उसका जन्म ही इसी से हुआ था, लेकिन आज तक कभी ऐसा नहीं हुआ है कि इधर कुछ सालों को छोड़ के कि आपको सरकार से परमिशन लेनी पड़े। अभी हमको साइक्लोन आम्फन में रिस्पॉन्ड करने के लिए एक डीएम के पास जाके ये बोलना पड़ता है कि आप एक लेटर इशू कर दीजिए ताकि हम सुंदरबंस में 100 गांवों में ये चीज़ कर सकें, इतना नाव हम बना के दे सकें, ये कर सकें, वो कर सकें। तो आई थिंक जो बैरियर्स क्रिएट हुए हैं, इवन इन दिस नेशनल इमरजेंसी, नो स्टेट गवर्नमेंट, एंड आई कैन से दैट मैं तब मानता इस बात की सक्सेस की कोई स्पीयर के 2 दर्जन मेंबर के पास में सरकारों ने कांटेक्ट करके ये कहा हो कि आप आइए और काम कीजिए, ये इतना काम करने का है, आप जो उसमें कर सकते हैं कीजिए। दैट लेवल ऑफ कोऑर्डिनेशन is not happening. And Sarabjit is right, but not a very happy sight. And that is, they are not natural allies, NGOs and government. But in a national emergency, ये अगर if by what Sarabjit has said is adversarial relationship, then there is a problem. इस समय में क्या आप चाहते हैं कि हम करें? हमारी ये सीमाएं हैं, इसके अंदर में हम कर देंगे, लेकिन हमारी दो दिक्कतें हैं. And if the government will say, tell us 3 things or 4 things which are bothering you, is stopping you from doing what you want to do, tell us 3 things. The NGOs will not make a wish कि ये कर दीजिए, वो कर दीजिए, सब कर दीजिए. Only the big problems which are stopping them. जो बिनोय भाई जो कह रहे हैं कि मुझे ऑक्सीजन का प्लांट मिल रहा है, every day if I have to go back and ask my operations director कि अगर मैं ये करूँगा तो इसका क्या होगा कानून के हिसाब से, कोई इसका कोई repercussion है? I am wasting my whole lot of time trying to find a way out because the laws are not letting me do something or the other. And I don't want to lament because ultimately, with or without government support, we will do it. I can tell you. वो कोई रोक नहीं सकेगा. हम अच्छा काम करेंगे तो हम कर ही लेंगे उसको. लेकिन ये जो वक्त की बर्बादी इसमें हो रही है ना, इन ट्राइंग टू फाइंड आउट, पहले चार्टर्ड अकाउंटेंट से पता करो, फिर किसी एक्सपर्ट से पता करो कि ये अलाउड है या नहीं अलाउड है, फिर वो एसेट का क्रिएट हो जाएगा तो एसेट का क्या करेंगे. These things are really bothersome for the NGO. But I'm sure there would be a way found out.
Yes, thank you so much, Pankaj. And Binoda, the very relevant point, a challenge in front of us. The issue has been raised, firstly, of the FCRA sub-granting and the assets management clause. And I've been assured by at a very senior level that the matter has been raised to the topmost level in the government already. It's lying there. Probably a decision can come very soon. That's what we are hearing, on this part. The second part of it is in terms of importing, whether it's the import of any equipment from outside of India or any such sport which is being offered, as Binoda you were saying, right? Again, onto that part, this aspect of it, once the asset is created, how the NGOs account for the asset, if it's given to the government or if it's given to any third person, again, a third party, so is it subcontracting all? So that issue has also been raised, I think. What we have got assurance a bit in the previous meeting with the NDMA is in terms of some kind of a facilitation will be done for the custom clearance and of any such materials moving in. On a case-to-case basis, the request is. So that's what's the point we raised and is there. And I'm hopeful the other things will come up. In the meantime, as Pankaj has said, I also believe it is the time of a critical emergency, and we know these are absolutely the things which would be probably life-saving. So while we are pursuing it with the government on the legal side, I think whatever things perhaps can be done, there may be ways and means, and we should look at, maybe putting up an asset, but still maintaining it with the within the NGO's accounts itself, or finding out other possibilities with our legal support and the CA's advice that what best can be done. I think we should be putting up for that. And in your case, Binoda, if you think Unnati cannot take up this request, there are other organizations probably who are already doing it. We can learn it from them also, or we can direct it toward them, those who have started doing it. So that could be my input to it. We should not lose a single possible resource which should be coming towards the aid of people at this moment. I think that's my very, very personal opinion about it, sir. With this, I think we come to an end of this very interesting session, a very interesting discussion.
Vikrant, just a minute. I want to have a last small point. In the spirit of a strengthening decentralized public health system, all of you must be knowing the 15th Finance Commission had set aside 70,000 crore to revamp the healthcare systems, particularly regard to COVID. In fact, it started with the example of Kerala, how Kerala panchayats have worked out on kind of controlling COVID. And my request to the government would be that at least some money should be released immediately so that panchayats can take action with regard to having isolation homes, upgrading some of the services, or buying some gloves or masks, those kind of things. Money should not be, because 70,000 crore, already 1 year is gone. 70,000 crore is not a big amount of money. It is both for urban and rural. So at least 30% must be released immediately. That should be our request.
Vikrant,
I've taken note of that. Maybe in the next meetings of the NDMA and Niti Aayog, I would definitely put it across there. And
forwarded
maybe one-to-one with the member of the NDMA.
Vikrant
Professor Santosh?
forwarded it to you the trade policy amendment regarding the import, which was issued yesterday. We can see that what leverage we can take from that. But again, in the Atmanirbhar Bharat package, on the recovery package of COVID-19, there is a massive fund has also been allocated for the strengthening of the health services, other than the Finance Commission recommendations. So both are there. Finance Commission, what Vinay ji has said, and that money was also in Atmanirbhar. The idea is to how to, like Government of India is importing so many of concentrator. What is the distribution plan? We do not know who is getting, which NGO, which civil society, or whether government will give to the hospital. So this you can have a discussion with the NDMA whenever you have a time and point, and how that is a plan. If NDMA not, that certainly Ministry of Health, they must be doing it. So just for information.
Sir, Professor Santosh, can we have a discussion very focused one with some officials from Ministry of Health also? Do you think we can plan for it together, whatever way it is? Maybe.
I'll talk to NDMA and we will think of having a meeting organized. And let's see that how we can facilitate the whole process. The questions which you have raised, like Vinay ji has mentioned, and also Pankaj ji has mentioned about that how to go for a kind of a FCRA and other thing, who property, which property, how it will be taken care of. Some of the clarity is needed on a very fast track basis. Then only we can attack the situation. Otherwise, we are already overwhelmed by the situation. So the idea is to, without wasting much of time, we should have that cracking out.
Sure, sure. Certainly, we'll follow up, offline from this meeting, Professor Santosh.
Say by this evening.
Yeah, certainly. Thank you so much. I think we had a very interesting session today. We had a range of discussions looking at what possible roles the NGOs can play in this pandemic wave 2 crisis. And we look at the issues, very short-term, immediate ones, to the going, in parallelly important concerns of food security, psychosocial support, and others along with it. But what could the focus, going midterm and the short term? And within that, the importance about it's not what NGOs can do, as Sarabjit has brought up, is what NGOs will do. That kind of conviction not there, perhaps because we lack the humanitarian architecture that's enabling NGOs. That's enabling to look at some of the very big challenges which we are facing it. Even in terms of addressing the critical needs which we are all facing today. I think limitations by the legal framework, limitations in terms of capacities, limitation in terms of interface and relationships, especially as we go more and more local. How do we look at boosting local coordination? We have dealt with a whole range of issues in today's discussion. We take note of that and we summarize it. From here, I assure all of you that we will distill our points for advocacy, and that's what we'll take it to the forums where the NDMA, Niti Aayog, and other opportunities are. And also we will look at an action points which are emerging in the terms of program framework and other actions, and that we will boost it back to our collective programming and coordination.
And you may be aware about that Niti Aayog's letter, Amitabh Kant's letter, which has given for calling them all the civil society group to be. And the second is also that the list of the CSOs on the Niti Aayog, and there they can do business directly without asking any permission. So that's what Pankaj was telling. So they are already approved kind of a CSOs.
Yes.
So there doesn't require any permission. I will just information. Mujhe lagta hai, I will just find out again on that issue also, Mr. Pankaj. So what you have mentioned is very relevant.
Sure. Those are the organization which is on the Darpan website of the Niti Aayog, and my reference to beginning in the beginning of today's session was to the same Niti Aayog letter. While the experience goes very different in different local context, as Pankaj was mentioning the case of Sundarbans, maybe the letter is issued in spirit. We have yet to see the realization of that kind of enablement at the local levels. But nevertheless, I think some good steps have been rolled on, and we put all this together, and the summary of action points, we stay connected. I think next week again we have a series of important discussions to take on through this COVID Academy sessions, and my colleagues Valerie and others, they will keep all of you posted about it. It's my moment to thanks everyone. Thanks Dr. Ritu, thanks Pankaj, Professor Santosh, Sarabjit, Binoyda, thanks all Kanak Srivastav, Dr. Rajni Srivastav, and all our colleagues who have been able to take out time. I know very stressful and being with us. Sorry, Professor Santosh.
I'm saying you thank Ritu also. She's there. And
Yes, yes. Thanks, Dr. Ritu.
Thank you very much, sir. I think one point that we did not discuss was the role that those on the front line are providing, wearing PPE and, providing care in such difficult conditions. I think if there's anything civil society partners can do is also to appreciate, the role of the corona warriors. Let us give them the appreciation that they deserve. It's not easy, the kind of work that they are doing, very long hours, and we are already seeing that fatigue is beginning to set in. So we really have to, strengthen the morale of those who are working on the front line, and many of them are also getting affected themselves with COVID. So I think that is something that we did not, bring up. So before we close, I thought I'll just mention that.
Very aptly, Dr. Ritu, and actually on Monday, perhaps on Monday or Tuesday, this is our next discussion. India's COVID workforce, the challenges they are facing, be it in terms of the long fatigue, but as well as a lot of workforce themselves getting affected. So and morale of that. So I think that's the point very well taken, and I think we must raise our hand and put up an appreciation for all the good work being done by our COVID warriors on the front lines. Thanks a lot. With this, I once again thank you everybody, and I hand it over to my colleagues Gohar and Valerie for any final closures. Over to you, Gohar.
Thank you, sir. Thank you so much. This was really a wonderful session. The session was very insightful, and the key takeaways really need of the hour, especially focusing on the critical and the operational supplies for psychological and mental health, economic repercussions, decentralized setup to reach out to the people at village level, local level planning, involving local NGOs, social discriminations, the stigmas related to religion, profession, etc. Definitely, we need to take into consideration the stigmas while CSO programming. Thank you for making the session so much interesting and informative and valuable inputs. It's my privilege to have been asked to post vote of thanks on this occasion. I wish to express my sincere gratitude to all the delegates speakers, including Professor Santosh from NIDM, Dr. Ritu from WHO, Mr. Sarabjit from UNICEF, Mr. Pankaj Anand from Oxfam India, Mr. Binoy Acharya from Unnati Foundation for sparing their precious time despite their busy schedule and honoring us with your valuable presence and sharing their valuable experience, knowledge, and expert advice with us. I must mention our deep sense of appreciation to Mr. Vikrant Mahajan for such wonderful moderation and guiding the session to its logical conclusion with his vast knowledge and experience. I also extend my thanks to Ms. Valerie Agarwal and Silju Abraham for their professional support and making this event a success. I also thank Mr. Sanjay Srivastavji for joining us and sharing the insightful thoughts. I thank all the participants for their valuable presence, active participation, and staying with us during the session. All the participants can, all the participants can also join us in our future sessions as well, about which we can have the regular announcements. I wish all of you happy and safe living. We hope to see you in our future sessions. Stay safe and stay healthy. Thank you.
Thank you so much, Gohar. Thanks for all your support.
Thank you.
Thank you.
Thank you, sir. Thank you so much.
Bye.